Hi, I'm Casey, founder and president of Wildlife ABQ, and this is Steve Wade, CEO of Unity BPO.
Hi, Catherine.
Hi.
Thanks for having me here today. I really appreciate it. And I thought I would tell you a little bit about Unity, give you kind of context with the conversation today.
That'd be great.
Unity is a health technology company. We're in two markets today, serving both the home health, hospice, long-term care market, the post-acute side, and then obviously hospital systems and the acute side of the market. What we provide is really a holistic set of offerings to clients in the healthcare space around technology. The one thing I tell our employees is that we're a lifeline for those doctors, nurses, and patients, just like they were a lifeline for us when we were born and throughout our lives for us and our family. So that to me is really, really important. It's a very purposeful mission that Unity has. Our business is traditional technology, the applications and IT hardware that you use. We're also involved in electronic health records. We're involved in utilizing platforms for managing a lot of what we do today. We have workflow automation platforms. We have unified communications platforms. It's the idea that we can collaborate with clinicians and patients any way they want, text, voice, video, those sorts of things. We're introducing a lot of AI technology into our business as well. It's the idea that we can build bots for self-service, make things less expensive, more convenient to use. We're using AI to capture sentiment, tone, the emotion in those tens of thousands of calls we have every week with clinicians and patients. And we're also using it really for automated scheduling, really reducing the cost of scheduling appointments. We do a lot around telehealth, a lot around hospital in the home and device in the home. A lot is moving to the home these days. And so with COVID, virtual visits have become far more common. And so we support that both on the clinician side as well as on the patient side.
Yes, IT support is definitely a lifeline. I know I've been on the other end of that many times as a nurse.
Yes, yes.
Yeah. Before we dive into some questions, I just wanted to briefly explain our primary care program as an employee benefit. Our program is an affordable, high-value service that adds to the current insurance benefit, and we'll talk about that a little bit. Employees love it, and self or level funded companies can save money actually doing this because we're able to bypass some insurance claims for routine care. So when you first heard about this model, what did you think initially?
Well, yeah, so, to be honest with you, as a CEO of a self-insured company, I'm always looking at that line item in our budgets, right, which is healthcare. And it's a big one, right? But it's not always about cost savings. The thing that I was really curious about is we have a really young company. We're very technology savvy and focused, right? I mean, everyone in the company certainly understands technology. And I always thought there was probably a healthcare experience out there that our employees would really like. We took surveys we had surveys with our employees, and the few things that they asked us, one is they want something that's convenient and predictable for them. But the other thing is they really don't want the company involved in their healthcare. And so we've been approached to put bricks and mortar clinics on site. We've been approached to have more concierge care by physicians who have businesses here locally. And none of that really made sense to me. We started talking to you, and it after sort of understanding what direct primary care is, we began to really understand the advantages of it, particularly with our workforce. So that's how we got into it. That's great.
Great. And did your thinking evolve over time? We've been talking for a few years at this point, actually. And so is there anything that you thought initially that you later found out was not, that you think differently now?
Well, we always thought it was going to be hard. And the reality is it wasn't.
Yes.
And I think that was probably my most pleasant surprise. You told us, look, this is a really simple concept. It can be. And I think for us, not really fully understanding it, it was daunting. But the one thing I will tell you is I really appreciate your willingness and patience to sit down with us, explain it to us, really to understand the value proposition, the ROI. And so when in doing that, we quickly understood that it was probably the thing we've been looking for as added value and to our more comprehensive healthcare that we already provide our employees.
Yeah, so you had mentioned that you thought it was going to be extremely difficult and then found that it wasn't. Human resources is actually usually the person, the group that has to kind of do all the
Sure.
work. And
Yeah.
did you get any feedback from your HR group? Did they think
We
it
did.
was hard or easy? Or
Yeah, no, we did. And actually, so we chose to do a pilot,
Yes,
right?
yeah.
And that was our way of sort of managing the risk a
Right.
little bit, right? And you were gracious to certainly go along with that. Our department, our human resource department, led the effort. Obviously, many of us were involved. And so the pilot was a huge success. The way we structured it is we invited employees. We had plenty of volunteers.
Mm-hmm.
They were very interested in it, and we even had some management team members as part of the pilot as well. And the feedback was really very positive. One, they liked the access, the responsiveness, the ease and simplicity of it all. And so for us, that was a great indicator. This was a good choice for us as a company to really add it on. I was comforted by the idea that we have, a very large healthcare provider here who provides our healthcare today, and that we can offer up Well Life as not just an option, but an added benefit to our employees. So it worked out great. It was very positive. Yeah, it was. Our employees are technology savvy, so they have the option to be able to do that, do a virtual visit, as well as they have a clinic, labs, and obviously even hospital capability if they need it.
Yeah, our system offered virtual visits since we started in 2017,
Yeah.
and no patients wanted it. Nobody ever really took us up on it here or there. And once COVID hit, it's becoming the new norm, and
So
everybody
everybody
does it. And
Yeah.
You have mentioned as we were talking that you thought this would be a really good benefit for part-time employees. What do you think? How do you think that's going to work?
Boy, it's been key, right? So, we're a 24/7 healthcare technology company. That's a long day, long week, long month, and we really need a part-time workforce to balance out our full-time workforce, given those hours and the work. And so, with our growth, particularly around patient engagement and telehealth, we're going to be probably half full-time, half part-time by the end of this year. And so when you start to look at the market, and it's become very competitive for talent, as you well know, we saw adding benefits for part-time employees was a real discriminator in hiring talent and then retaining talent. Mm-hmm. So we clearly saw Well Life being an option for us. Benefits are, albeit are limited, they do provide that part-time worker, that those parents that are working at home who are looking for a work-at-home work, those students, as well as the older workers who want an income. But the idea that we can give them benefits alongside that has just been a winner. And it's become really a recruiting and retention tactic for us as a result. Yeah.
That's great. So one thing I often get asked, and it's a completely valid concern or objection, is that companies can't and shouldn't force employees to see one certain provider. Sure. And as you now know, and it's a voluntary program. Employees are not required to participate. But did you run into barriers or objections for your workforce saying like you can't do that? Or
Yeah, well, it was clearly one of the questions we had for you in our initial conversations is, we don't ever want to mandate our employees go about their healthcare. The one thing we do want to encourage is to get more involved in their healthcare, right? And in some cases, I feel like Well Life really fills a gap there too. Mm-hmm. But there's no 100% participation. There's no mandate. They choose, and that's what we want, and that's what we really like about the relationship we have with Well Life.
One of the other kind of things that we had to consider when we were rolling out the pilot and then just moving forward is how did you decide when to add the benefit?
That's a great question, and it's not an obvious question, but we honestly didn't know. And one answer is you can add Well Life at any time, which is really brilliant, right? But what we've really figured out as a company is, look, we go through that annual pilgrimage where we're doing our open enrollment in the fall, October, November timeframe. Mm-hmm. And so we get through that and we get through the end of the year. What we found is that the best thing to do is get through that open enrollment with our more traditional insurance, which we really encourage our employees to have. And then we introduce Well Life after the first of the year, not to confuse the two things, but also just to make it easier for them to make one decision at a time, right? So that model works out great for us.
Pretty good, yeah. Yeah, open enrollment's certainly chaotic and complex, and
It is.
just adds another layer of complexity, and it's a benefit that's not insurance, it's not related to all those other things. So I think that's a great message.
Yeah, and with Well Life, honestly, it's a pretty simple enrollment. It's a very simple enrollment.
Yeah.
So it's not something we have to spend a lot of time on, but
yeah.
We just want to separate the two a little bit.
Yeah. We also find that even a company, whether they did it in open enrollment or outside, is really only about 10% of the employees will initially enroll.
Right.
And then those coworkers come back and tell their friends. And then so over the course of the year, they can enroll any time. It's not this like strict open enrollment period. So there's that too. But
yeah, and you bring up a good point. Word of mouth internally within the company is something that we witnessed and saw and observed, which is the folks who were participating in the pilot were talking to others, and so it became kind of viral that way, right?
Yeah, we love that.
Yeah, of course, yeah.
And so, other than recruiting and retention, are there any other benefits that you think it'll help with Unity? Or?
Well, yeah, and so I obviously emphasize recruiting and retention. That's really important for us. But what we've learned from our employees is they want options. The generation that works for us, they want options. They want some convenience. They want things sort of immediately, right?
Yeah.
And so I think we answer a lot of those questions by bringing in Well Life as part of our offering around benefits. The other thing is that we have a young workforce, as I mentioned. Especially the males, they tend to be invincible, and they really don't think they need healthcare insurance and all of those things. So we have found that Well Life also helps us with that audience of saying, gosh, you can have this, it's simple, and it'll help you, and again, it's all about just encouraging our employees to do more with their healthcare than they're doing today.
Absolutely. What challenges have you had with the program?
Gosh, I wish I could give you a list, but I can't.
I don't want a list.
No, you don't. But honestly, we haven't had any. There haven't been any challenges, I think. And to me, no news is good news. And so what I hear is really good feedback, and that's really important to me. The one thing I would counsel people on is, really good, effective communication is important as part of this process, right? So understanding what the features and benefits are and how it really can impact them positively is what we emphasized and promoted as part of the program.
Right. Anything else that I didn't ask you that you wanted to mention?
No, other than I think it's been a great partnership. I'm glad we found you. We had been looking, and we clearly were looking for options, and this really fit very well for us.
That's great.
Yeah.
Well, I really appreciate your time today,
Sure.
so we can get this message out to other companies, and I hope our viewers are able to benefit from this discussion.
You bet.
Thanks.
Thank you.